Okay, all set. Thank you.
Perfect. I'd like to call to order the Public Safety Committee of Monday, May 18th, 2020, 5:30 p.m. with the approval of the minutes from the meeting of April 20th. Do I have a motion to accept the minutes?
Motion to approve the minutes.
Second. Do I have a second? Oh, I'm sorry. Okay, thank you. Minutes are approved. We're moving to the open to the public section of the meeting of the agenda, and I have no cues on the video on the conference call, but I do have one that was emailed in earlier, so I'll read that one into the record, and it happens to be for the Central Connecticut Central Health District for Charles Brown, who will be giving his presentation next. So I will read in the public comment. Hello, I have two questions for Charlie Brown. The first question: both my mother, who is a senior citizen, and myself have significant health issues. While we would like to stay in our bunker until there's a vaccine, that won't be feasible going forward because of doctor appointments, etc. We can't telehealth forever. Can you provide some guidance on what precautions seniors and at-risk individuals should take as they venture out into the uncertain universe? And the second question, or second part of the comment: last week, my mother went to an X-ray at a local radiology office in Wethersfield. We called their office about 4 times in advance to discuss the COVID protocol, safety measures, etc. However, when we arrived, there was a deviation from promised protocol, and we were exposed to several people at close range. Is there any recourse for situations like this, like a place to share concerns that best practices aren't being followed by local medical facilities? Thank you for your help. Krista Mariner, 58 Farms Village Road, Rocky Hill. That's all the comments I have from the public. And so I'd like to jump right into the Central Health District's report. Thank you, Charlie Brown, for being present.
No problem. And I'll address the second question first, if I could. Probably the best way to go from that point, if it's a problem and you need to take it up with the Department of Public Health, their facilities licensing division does oversee the protocols and things of that nature. So if it becomes a major issue, I think a call there would be warranted. If it's feedback, and I think that we're all trying to kind of feel our way through these things, and hiccups do happen. Talking to the management at the facility, I think, would be the first step to make sure that they know both what happened, and so that give them a chance so that they can see if they can actually resolve that matter internally first. As far as going out in the public, we have been very protective of our senior citizens, and rightfully so. We've seen the highest impact to this be to our senior populations. So as we're all starting to venture out into the world and the universe, as they said, a little bit more often and come out of our bunkers, remembering the basics of protection for public health without having that vaccine, it's limiting the amount of contact that you have. So if you're a senior population, trying to only go out for what's essential, really trying to stay home if you can, having folks run errands for you if you can. If you can't, then making sure that you're wearing a mask or face covering. By doing that and assuring that others, with you are doing that as well, you do reduce the risk significantly of contracting this particular virus. So because that droplet spread and everything really gets caught by that face covering. The final thing, hand washing and sanitizing, and assuring that you're not touching your face as you're out and about, making sure that you take the time to be able to do that hand hygiene so that you're not carrying virus from other places up into your where you can actually breathe it in and potentially get infected. I think that they were doing the right things, already calling ahead, finding out what the protocols are for the places that they had to go as far as medically is concerned, and also just expressing the concerns that they may have with respect to their own health and assuring that people understand that.
Thank you.
So I guess now is the time where I get to actually report a little bit on where we are within this pandemic. Right now, currently, Rocky Hill, as of this morning, actually, no, this afternoon, had 357 confirmed cases of COVID-19. We've had within our district 139 fatalities as of this afternoon. Most of those fatalities, unfortunately, are within the senior population, 60 and above, with the vast majority 80 and above. And Rocky Hill does have a significant portion of those cases. And the reason why is Rocky Hill, both Rocky Hill and Newington in our district have a large proportion of nursing homes. Many people may have seen in the national news that nursing homes really contribute a huge chunk of fatality and the number of disease that we're seeing here. And it was one of the reasons why early on we actually closed off the nursing home to visitors so that we could protect that population. This virus is a very opportunistic virus, and it does have very unfortunate results to some of our most vulnerable populations. So we're seeing that happen right now. Unfortunately, I mean, with Rocky Hill, the number of deaths that we've seen has been extraordinary. We have a case fatality rate in Rocky Hill currently that's over 20%. And like I said, the majority of that really does exist within your nursing homes. That being said, I think that the nursing homes are doing everything in their power to be able to address the situation that they've been given. They've been short on personal protective equipment. They've been following their infection protocols and working with both us and the Department of Public Health to try to address the situation as well as they possibly can. So it's a major challenge, and one of those that we recognize, especially when we start to deal with folks that are especially frail, may have do not intubate, do not hospitalize, do not resuscitate orders as well. So we're seeing those folks unfortunately pass here at the very beginning of this epidemic. Other than that, we stand on the cusp of the point to where we're getting ready to remove a lot of our restrictions. And as a public health professional, I have to admit that I'm anxious about this because the public health restrictions that we've had in place for the social isolation is really the only thing that we've had that's really kept this virus at bay. So trying to remove those restrictions without the assurance that we have enough testing and we really understand what the status of our community is and where the virus is within our communities is very, very concerning to me as a public health professional. I know that we've had increases in testing that in the recent days, but I also know that the majority of those testings may not be available to everyone. There are still restrictions and a lot of focus on the tests. And when you see testing increasing here in the last week, has been within that nursing home setting. So the numbers, while they're going up, may not be reflective of what we have, the disease status that we have within our communities. So I become very concerned when I see those types of numbers and have that uncertainty and know that we're starting to release kind of our restrictions that are keeping us safe. I would like to recommend or just to say to everybody, as we're getting ready to, come out of our shelters, so to speak, remember the things that we've said from the beginning. Wash your hands, make sure that if you're sick that you stay home and assure that you're covering your cough, wearing your face coverings appropriately. To take what's essential. do those things that are essential, but please protect yourselves. This virus has not gone away. There's not been a magic portal that's taken it somewhere else. It's still out there among us and amongst us. So we need to assure that we protect both ourselves and those people that we come in contact with as we start to come out of this particular restrictions. Especially going into the summertime. This coming up week is the beginning of summer with the Memorial Day. And I know it's going to be the inclination for everybody to go out, see friends, see family, and to try to come back to what normal summer activities are. But I cannot caution you enough. Don't give in to the hygienic fatigue and not wear your mask. Don't give in to the perception that everything is still the same as it used to be. It is so important to everyone that we continue to do the things that have kept us safe up to this point. If we don't, we really do risk a resurgence in this disease come the end of June to the beginning of July. And the one thing that we don't want to have explode on the 4th of July is this particular disease.
Thank you, Charlie. Any questions for Charlie?
Yeah, I have a couple questions.
John?
Charlie, I totally agree with what you were saying. Just a quick experience I had like 3 weeks ago. I was getting a part of the metabolic testing for my company was a blood test. And I went into what was equivalent to Quest. It wasn't Quest, it was a provider blood draw in Wethersfield. And the woman wasn't wearing a mask. And the woman at the front desk had her mask over her neck. This is during the peak, obviously. So does the Department of Public Health like send out things to providers, like communications that it's mandatory, you have to wear these things? And I mean, what communications are sent out to these people?
In general, they give guidance on their protocols that they should be wearing a mask, that they should be wearing gloves, the same type of personal protective equipment that our EMTs and folks are wearing when they're seeing patients. So there is a basic clinical protocol for those types of encounters, and they should be following that. And if you as an individual see that they're not, bring it up. Ask the question as to why. I think that we all have to become our best advocates in this environment, and to remind folks, because once again, I use that term hygienic fatigue, and I'm going to trademark it because I think I'm the one that came up with it. We're getting really tired of wearing a mask. We're getting really tired of washing our hands, and that's something that we can't let go of. But when you see somebody in that circumstance, if you have the opportunity, bring it up, especially if you're in a customer situation as you were. That's something that they should absolutely understand. And once again, if they're unwilling to hear it on an individual level, speak to their management, because trust me, they're putting themselves and their company at risk by not adhering to those standards.
Right. When you were talking about statistics and those affected in Rocky Hill, when you say nursing homes, do you include assisted living, or is it just like the Maple Hills and Apples?
Currently, right now, it's the long-term care facilities, so more of the hospitalization where people are in rehab and things of that nature. We have had some cases within assisted living, and we've seen some of those scenarios, but it hasn't been quite as bad. I think, once again, I think that some of our most vulnerable actually are in those skilled nursing facilities. And that's why we've seen such a high case fatality rate there. And unfortunately, the staff there, even though they have the best intentions, a lot of times because of the patient's wishes, they may not have the opportunity to actually do anything when they get that type of infection. So it does boost the numbers quite a bit with respect to that. But at the same time, it's something that we have to watch. I'm as a public health professional, I try to watch the numbers to see where we are. And the only real number that I can see right now that I have any real confidence in is the hospitalization rate, because we're actually seeing that decline. So that means that hopefully, if the virus is within the communities, that we're not seeing it to the extent that people can't manage that particular disease without going to the hospital. That being said, it's kind of a little bit of a leery data point as well, because people have been avoiding the hospital until the very last thing, because the last thing they want to do right now is go to the hospital if they can avoid it. So the data, I think right now, and I think we're going to get better as we go along, is being I think it can be very skewed. And it's difficult as a professional to be able to interpret what we have and know with any certainty, really, where we are within this pandemic and where we are as a community with our disease status.
Thanks, Charlie. Ed, is John on?
What's that, John?
Is John on? Mir?
John Mayer,
Yeah.
yes.
Yeah.
Yes.
Oh, hey, John. One question I got, John, from a resident was June. I mean, we heard May 20th, things are going to be opening up in a limited capacity, but they're wondering, I think some people are assuming that the senior center is opening up.
No, well, we're just starting is having the people that have been working at home come back in and start making sure that we're organizing the office space to accommodate this the virus and so on. But we're still keeping the town hall and the community center closed for the time being. And most likely the senior center won't be opening in the near future because we're going to be starting on construction soon. So it seems to be wise just to keep it closed until the virus is under control or closer to where it makes sense to open it up for use even during the construction over the next 12, 15 months.
Okay. Now, with the loosening, as we go along month after month, I'm sure there's going to be additional loosening of restrictions on a state level. Is there anything that you see on the short-term horizon being loosening up, like the food pantry people showing up to get food, or anything from that perspective that would be loosening up?
Well, they can show up and pick up food. It's similar to when you go to a takeout restaurant. They may bring the bag outside and drop it off, and then the people just pick it up and take it back. Or we could even deliver it to their house through the minibus drivers. That, and we're trying to come up with a safe, distance safe way of opening up the transfer station. And we've done that the past 2 weeks with a Friday and a Thursday Friday. And probably sometime after Memorial Day into June, we'll go back to our regular 3 days schedule. But so far we're trying to work the bugs out with on Thursday, Friday, so that basically the people that are coming in to bring stuff to the transfer station are actually bringing the whatever they're bringing into the appropriate dumpster or pile where there's no really, staff isn't really giving any help to. But as of right now, and talking to Craig, he's interested in opening up perhaps the dog park after Memorial Day.
Okay. All right. Thanks, Ed.
Thanks, John. Pankaj, any questions for?
Yeah, so I was, Charles, like, I was looking at these numbers, 357 and 139. Did that get them correctly? Like, it's 139 deaths, 357 cases. It's like about 35%.
Well, the 139 is through the entire 4 towns of our district. Unfortunately, we had a little bit of problems with the disease surveillance system that we use, so I couldn't pull out the number of deaths specific to Rocky Hill prior to this meeting.
Yeah, because I thought that was over like 35.
Yeah, no.
That's really high, because at some point you said 20%. So
yeah, the 139 is over our 4 towns. As of yesterday, or as of Friday, actually, the case fatality rate was over 20% within Rocky Hill.
Okay. Okay. That sounds better, although like it's still pretty high. On the same, in the same way, and staying on the same topic, do you know like how we are doing compared to other communities from a statistical point of view? Let's say it's 20%, the stipulate like it's 20% even today. And if you compare Rocky Hill to similar demographically, demographic towns. Yeah.
So our 4 towns within our district are pretty homogeneous. You know, they're very similar between Rocky Hill and Newington, especially because they have the same number of, or similar number of nursing homes. So for the 2 towns, Rocky Hill and Newington, Newington had an 18.7% case fatality rate to Rocky Hill's 20.7, actually, so close to 21%. You contrast that with Berlin and Wethersfield, that are similar demographically, but don't have the nursing homes. And their case fatality rates on Friday was a little over 8% for Berlin and 4.8% for Wethersfield. So it really does, make a difference, the number or the population that's actually being affected by this. And that was one of the main reasons why, at the beginning, we locked everything down as far as the nursing homes were concerned, because we knew that that was the only way that we had to protect them at that point. And unfortunately, this virus, as I said, is very opportunistic. So it can find a way in, and then once it finds a way in, it has a tendency to run like wildfire. That being said, conservative estimates right now, as far as our communities and the population as a whole, we may have only had, 5 to 10% of our entire population that's been affected by this particular virus. So as I've mentioned before, in these instances, one of the things that we want through immunizations generally is herd immunity. And people, have been thinking, okay, well, if the virus is running rampant, then maybe we'll have that herd immunity soon. Unfortunately, we need at least a 60%, if not more, to really gain some sense of herd immunity from the virus as a whole. And being that we're only at 5 to 10%, we're nowhere close to that. So that's one of the reasons why I continue to just, try to hammer home the need to really just be vigilant in this.
Yeah, so the reason I was asking you about this comparison, because the raw numbers tell you a story, but the moment you compare them to a peer level data, if you will, right, then it tells you a different story. And also, just because local conditions are different, like as you pointed out, right, all this is driven by nursing home population, right? You can, when you look at similar demographically similar towns, as you pointed out, right? So the question is really, is there anything towns like us, and obviously we are talking about Rocky Hill now in particular, should be doing anything differently than the state? Because just like the country, right, we hear this all the time, like one size doesn't fit all, right, kind of thing. Like your situation is different. Some places are like still rising, some places are going down. So what should we be doing differently? And I don't know if you have the answer. Like, this is more of like my curiosity. I don't know if there's something we should be doing differently than, say, Wethersfield, right? They are at 8%, we are at 21%. And then we open up everything, or, have that, at least, I just want to have that conversation where like we are not, just having a cookie cutter approach, right? And explore if there is something we can do differently to keep this down, right? Because you are at like 3 times the rate of Wethersfield, right? And we're treating it like we are all the same.
And I will say this, the difference really is in the nursing homes. So you take away the nursing homes and your numbers would be very similar. So, that's where the real challenge is, because I can't take those away as a whole. So, I think that, to kind of go back to your cookie cutter approach, I think that the one thing that's really stood our district in good stead has been the consistency with which all of our towns have approached this. You know, we've been working closely with folks since January to talk about the appropriate planning steps to be able to do what we need to do to be able to protect the communities. And I think that they've done that effectively. And having that consistency between towns really provides a good, solid message for all of our citizens. The problem that we have is there's not a lot of tools in our toolbox right now to really change it up and say, we need to do something differently. If we had a vaccine, for example, I would be prioritizing those nursing homes, and that's probably exactly what we're going to do when we have that tool at our disposal, is prioritizing the senior populations and the most vulnerable. They'll get the priority to be able to get that protection. Without it, the only thing that we have to really protect our folks is to do those basic things that stop the spread of the disease, you know, because that's the one thing that you can do. So I caution all of you, you know, I know that we want to get back, you know, the services and the things that we have in place, but I think a very stepwise approach is the most prudent at this point. Because what I'm afraid of, I really am, is when we get to Memorial Day, we get to the picnics and you see people just walking around now, as John said, without their mask, without you know, the things that are in place to protect them, that we're going to see, you know, 3 to 4 weeks later, because it takes some time for that disease to pick back up, that we're going to see that resurgence in the disease. So, you know, my biggest recommendation at this point, Pankaj, is caution. You know, let's not pull back on the restrictions too soon. And I know that you as a town and councilors as well want to serve your communities. That's what we're here to do. But right now, I think we serve them by being cautious in our approach to opening things up and providing the opportunity for folks and reminding them of their responsibilities with regard to this particular virus.
Thank you.
Thanks, Pankaj. That being said, thank you, Charlie. Chief Custer, I know you were involved in terms of accreditation and meetings, and I don't know if you have to run. I can jump forward to your report now. If you need to leave, please.
We're done for the day, Ed.
You're
so
done?
There's no rush, but if you'd like a report, I can go now if you wish.
Sure. I just caution you that I don't see any cyber numbers here, and Pankaj will be looking for cyber numbers.
Well, I'll tell you what. Now that we're done with the budget, and let's get through the audits this week, and those numbers will be back for the next meeting, I promise.
No, that's fine, Chief.
Okay.
Thank you.
Just a quick overview on the department related to the COVID situation. We're holding up pretty well. You know, fortunately, we're doing really well with our PPE. We're getting regular supply deliveries every Wednesday from Region 3. And we're expecting a larger delivery this week because I guess the state got a big bump in PPE. So, you know, we're in good shape on that end. Personnel-wise, we're doing well as well. Only one officer out right now. And it's more because we're just being cautious with her. She had a slight fever, and so we had her report back home, and we're going to watch her. But otherwise, we're at full staffing. I did get a call today, Charlie, at my office from a woman claiming to be a hairdresser in town. She was extremely upset because, as you may or may not know, I guess the governor has now backed off on the opening of barbershops and salons this week. And she was very upset, and, you know, had gone on to say how she had bought product and they were all ready to go. And here we are 48 hours out, and everything has stopped. So we kind of referred her to the governor's office. There's not much we could do, but here's an interesting point. And we've talked about this. The reason why she was calling was she wanted to know if we would arrest her. if she opened up. She was serious too. I think she
I
was
know.
open up against the orders. So we explained all that to her. I think we corrected that situation, but it just goes back to that fatigue you talked about, Charlie. And, we're going to keep an eye on it too. You're starting to see it in individuals. Parks and the trails, hiking trails have been busy. On the weekends, we've been deploying the all-terrain vehicle out there. That's worked well for us. I too am a little concerned about this weekend coming up with the holiday. I don't know what to expect, but we'll be ready. Other than that, we're pretty much status quo. We've pretty much been able to maintain all other operations. I'm happy to report that one of the recruits has finished her training. So we got her now on field training. It's been a real adjustment with this online learning. So one is out there in the field training now. The other two still have another month to go. So for the most part, we're doing relatively well. We've had to make some severe adjustments, but that's becoming the new norm for us now. So I feel confident we're going to be okay. That's it.
Thank you, Chief. I'm really quite thrilled with the way the department has treated the community. Everybody, just from walking in the park and getting out in the quad, out on the trails, and just really handling folks with kit gloves, I think is, and not throwing the book at them, so to speak, just trying to educate them and point them in the right direction. So I personally am very appreciative of the way you've been handling that. Any questions for the Chief, John?
No, thanks.
Punkage?
Anything unusual, Chief? Anything to point out? I know we are all pretty busy with this situation, and that's where we are focusing. Anything else? Any spikes? Anything you want to call out, or anything unusual or out of the ordinary? Just on a regular basis, yeah.
Yeah. Well, like we had discussed last week in our other meetings, yeah, we're starting to see a slight increase in some criminal activity, to be expected again as the weather gets better, to be expected as Charlie said, things start getting loosened up. But happily, it hasn't been constant. We see, for instance, last week we got hit with some car break-ins, and we thought, here we go. And then it kind of died out as quickly as it came. What we are noticing now, in the capital region, robberies are starting to go up. So I don't know if that's a byproduct of just normal criminal activity, or maybe people are getting desperate. I don't know. Luckily, we have not been hit yet, but our surrounding towns have. So we're working with the task force on that. So yeah, you're starting to see these things starting to pop up. It'll be interesting to see if they continue or if it's just a blip on the screen.
That's a really good point about the economic situation, right? Something to keep an eye out on, not from a regular, what you would expect normally, or is it because as the economic situation gets worse? That's one of the problems with this, right? You kind of open the door to those kind of problems. So it's a tough act, but that's a really good point. I think something to watch out for, I guess.
Okay, I'm watching the time a little bit. We're at 6:05, and we have to give 5 minutes for our Zoom staff between the next meeting that starts. So I'm gonna hustle along to ambulance. But before I do, Chief, anything you can share on your accreditation? Is it a go?
So it's a 2-day process because they had to go online versus in person. We went from 4 days to 2 days, so that's good for our stress levels. So we got through day one today, and things went very well. So we got to get through tomorrow, and I think we're going to be in good shape.
Good luck on that. Joe Gribb at ambulance.
Okay, for the month of April, we had 407 calls. Year to date, 1479. We currently are maintaining our membership at 77 people. Everybody's been healthy. We haven't had any issues. We instituted a bunch of safety precautions right in the very beginning of all of this. The crews wearing masks, the patients wearing masks, any outside travel. We put people in quarantine when they came back from it and everything. And it's great helped us out, I think. There's ambulance services around Connecticut and throughout the United States that have wiped out their whole service because a couple of people have caught it, and it spread through the service, and they had to actually shut the ambulances down. So we've been very fortunate. Nobody's sick. Everyone's doing very well. I just had a couple of questions for Charles. The initial projection was 10 to 20% for the first go around. 20 to 40% of people were going to be affected by it the second wave, and then back to 10 to 20%. What, if any, if you know offhand, what was for this first go around, have we hit the 10% mark, or?
I think optimistic estimates may point to that, Joe. But we really don't know because of the status of the testing. I mean, to be able to really tell where we are is just an estimate at this point, because testing hasn't been widespread enough for us to really get a good sense of that particular number. I think, and this is just my gut, that, we put in the restrictions, I think, fairly well, and people had been adherent to that. And I think that we have been able to bend the curve down significantly because of that. And I think that's what causes me the most trepidation about a reopening.
I agree. My biggest concern is as businesses start opening up, and I understand completely, we talked already, and I don't want to be in that position to make that decision. But I've noticed more and more now people are already getting very laxed and not wearing masks, invading people's personal spaces less than 6 feet away. And we're still in the beginning phase of this. And once we start opening businesses and people start socializing more, I could see where it would double for phase 2, unfortunately. One other quick question was, did they, we were required to set up fields in our patient care reports to track all the COVID type calls or COVID positive calls and COVID symptoms calls. Do you get that information?
We don't get it directly. The Office of Emergency Management Service at the state compiles a lot of that information from the reports, and they're using it to be able to look at trends across the across the region, across the state.
Okay. And that was it. The only other thing I had for the council was, this is EMS week, and we've been praising our members. We're 77 strong, and we haven't lost anybody or had any sicknesses or anything like that. And the members have been just stepping up to the plate every day, volunteering their time and putting themselves on the line for the town and for the people that come through town. And I praise them every time I see them, and I just wanted to praise them in front of the town also. So
it's
EMS week. Emergency Medical Services Week, yeah. So recognizing all of our members and all ambulance providers. So everywhere.
And I think evidenced by the signs around town, the lawn signs, I think people are right there and feeling grateful for sure. Pankaj Prakash and John Emanuel, do you mind if I call in Chief Garahid so he can start his report, or do you have pressing questions for him?
I don't have any questions. That's fine.
Fire Chief, you're up.
All right, I'll try to make it brief, and happy EMS week, Joe, and to all your members. We responded to 34 calls last month, but we're starting to see an uptick now. Manpower is remaining constant at 70. I'm going to try to make this brief for you guys. Our community outreach, we did a number of the birthday parties. We also were able to get the flags out on the Old Main Street and Chapin Avenue, a little bit Allen and Parsonage, the Memorial Day parade route. So the flags are up. As with the other two organizations, we have COVID procedures in place. We have an administrative directive and an operational directive. Our PPE is in good supply, and we haven't had any members come down with the work-related COVID yet. So, you know, knock on wood, hopefully we're doing something right. And with that said, we're developing a new training model to restart our tactical training while employing the appropriate safeguards. The target date for the implementation is June 9th. And let's see, that's about all I have, with the exception on the report in front of you. I questioned the training hours, so I want to double check that, and I'll get that out to you through the town manager on the department's monthly report.
Thank you.
And Mike Custer, good luck with accreditation. If we can help, you got my number.
Okay, I think they're going to be calling you, Mike. So
Okay.
I'll take you up on that.
You got it. Phone's on.
You had public call. The public call, did any action on that public call?
That's tomorrow, Ed. So
Tomorrow. Yep.
that's back for tomorrow.
All right. And guys, any questions for the fire chief? John? Punkage? I hate to cut everything short, but I know we need, for technical reasons, we need a little 5-minute gap before we start the Farmlands Commission. So in the essence of that time, I thank everybody for rolling through very quickly. Congratulate you all. Charlie, no hygiene fatigue in these departments. And also very impressive that our PPE counts with all the departments so far from the start to this point have been really solid. So maybe we need to focus on our nursing homes and assisted living if they fell short on PPE, because our department heads have managed their supply pretty darn well. I don't know. I think, John, you concur. Punkage, you concur on that?
Yeah.
Absolutely.
Thank you. Thank you, gents.
Ed, we need a motion to adjourn.
Just motion to adjourn?
Yep.
Second?
Second.
All right. Good night.
Thank you.
Thank you.
Good night, guys. Thank you
Hi,
so much,
everyone.
everyone.
Wash your hands, folks. Have a good night, guys.
Night.
Good night, Charles. Oh, no.